Welcome, everybody, to Dr. McDougall's bi-monthly webinars. And boy, we have a surprise and a wonderful webinar planned for you today. I'm Gustavo Tolosa, and today we have a special guest. Dr. McDougall has some news to give you that are quite amazing. And we have a battle to win. So let's get started. How are you doing, Dr. McDougall?
I have to say, probably today is one of the best days I've had. I'll tell you, I'm serious. If I have to look back at particularly the last couple of years, I have to say that I'm on top of my game today, and I'm excited about things today. But let me put it in perspective. The Consumer Electronics Show was, 2 weeks ago? That's where they get together with all their electronics and so on. I used to go to that show because we advertised a television show of our own, McDougall MD and Lifestyle Magazine. And as a result, we were at the Consumer Electronics Show, and I walked up to Larry King. You know who Larry King is? I walked up to Larry King, and he looked at me and he says, "Hey, you're the guy from Hawaii that was on my show many times." I said, "Yes, and I would like to be on again, if you ever have a show." And he said, "You were way ahead of your time." I said, "Yeah, I was. Why did you have Fat Andrew Weil, on telling people how to lose weight by eating olive oil? Why did you have Robert Atkins on telling people to eat meat when you knew I was ahead of my time and I was right?" That's what I told Larry King right there on the floor of the CES convention in Las Vegas. Yes, I did. Well, folks, the reason I'm excited today is I'm no longer ahead of my time. That's right. I had to live to be 72 years old, but good grief, the times have finally caught up with me. Let's go to the first slide, Gustavo. That's the one I want to see. Okay, Canadian Dietary Guidelines of 2019 came out last week. Now, they purposefully, if you read about this, and it's all over the internet. If you read about this, you'll see that the authors purposely excluded the dairy and the meat industry from input other than the average citizen would have as an input to the guidelines. Excuse me, the dairy and meat industry, they've written the dietary guidelines for the U.S. for all these years and have had a huge influence on Canada. Well, Canada stepped out this week. They recommend diets and fruits make up half of your meal and choose protein from plants, not animals. Excuse me. There's a notable absence the dairy industry brought out of dairy products represented in their basic plate. And if you see the plate there on the left side of the screen, you see that dairy, there's no glass of milk, there's a glass of water. The amount of dairy products is hard to even find. Yeah, water should be your beverage, not milk, because it's poisonous. And the dairy industry complained because their products were not represented in the new dietary guidelines. I mean, that really made me feel good. Canada, you're so far ahead of us. I mean, you told your women that breast self-examination was wrong in the year 2001. You came out against mammographies. You came out against colonoscopies. Good grief, Canada's got something going for it. We hear all these criticisms about universal health care. Well, I have to say they care more about their citizens than they do in the U.S. Now, that made me happy. And I was going to talk to you about these dietary guidelines. But something happened yesterday, which was January 23rd, 2019. This is a live show, folks. What happened yesterday, next slide, Gustavo, is the Lancet, one of my favorite medical journals. The Lancet Commission came out with the EAT guidelines. Excuse me, they came out with the dietary guidelines on January 24th, 2019. And they said for our species to survive, in other words, we are going to vanish. For our species to survive, we must mostly eat vegetables, grains, and nuts and limit the consumption of red meat to 1 time a week. I know that's covered up for you. 1 serving a week of red meat. I mean, that's almost the victim of the McDougall program, except, I don't eat meat at all. But the average American eats 222 pounds of meat a year, meat and poultry. I mean, this is world changing, folks. I am no longer ahead of my time. The time caught up, but we're just getting steamed up. I'm just getting excited. I'm just getting mad as hell. I'm ready to, just give me a platform. You would think that the Lancet Commission or the Canadian Dietary Guidelines or the U.S. Dietary Guidelines or maybe some local physician here in Portland, Oregon, or OHSU, or somebody would say, hey, you know, we got to start talking the truth about diet because there's everything at risk. Our children, our grandchildren. In fact, one of the politicians that's running for the U.S. presidency in the year 2020, one of our presidential candidates came out and said that global warming will take over this planet in 12 years. I'll still be alive and doing this webinar in 12 years. So it's time to act now. And whatever you can do, do it. However, today's seminar is not about that. Well, not directly, but it's a problem as important to those who suffer from it as our next two guests. One of them said she was considering suicide. I mean, that's personal destruction. So this problem we're going to talk about is as important as planetary destruction to the individual. I mean, for me, I'd like to introduce our guests. Is Jeff with us? Jeff Nelson, my good friend.
Hey, John.
It's Dad. This is Dad. Dad and I have been friends for 35 years, and we're really good friends. You know, I may speak casually of people I know or associates or so on, but you identify very few people as my close friends. Jeff Nelson and I have had that opportunity for about 35 years. And he has two daughters. They happen to be twins, and I still can't tell them apart. So they are Nina and Randa. Raise your hand, Nina.
Hi.
There we go. Okay, and Randa. And I've known them for their whole life. In fact, I got to meet all the family about 30 years ago when Mom, I guess Mom's out taking a break, but Mom, Sabrina, was suffering from relapsing polychondritis. And her doctors told her she was dying. She was going to lose her nose and her ears. And her mom, or actually Jeff's mom, told her about the McDougall plan and that she ought to read it. And she stuck it on the shelf for a few years and finally did read it and changed her diet about 35 years ago, and her disease completely disappeared, relapsing polychondritis. And that's how I was introduced to Jeff Nelson, Nina, and Randa, in that order. That's how I got to meet them. And Willie's not here, but Willie the brother, also had a case of acne when I met him. And it all cleared up too, just like, well, anyway. Well, acne is what we're talking about. Acne is the subject. So would you, who would like to start? Nina, Randa, Jeff?
We can start.
Why don't you move up?
First of all, let me start out by some of the things that I learned today. There's a YouTube up, which I would encourage you to go see. It is done by Rip Esselstyn at a conference he gave. He's the host. And it's these two young women who give an absolutely outstanding, breathtaking speech on their trials and tribulations. And I was just going to watch 2 minutes of it this morning just to get a flavor. But I was tied to that YouTube video for a half an hour. And you should, it's amazing. You guys are, well, you should be. You're professional actresses. Tell us a little bit about some of the, was it Timberlake you met?
Justin Bieber.
Justin Bieber. Tell us about some of the people that you rub elbows with as models and actresses and doing various television and
Okay, so when we were about 16 years old is when we decided we wanted to start pursuing a career in entertainment. And by the time, we were getting some jobs. We were working with Justin Bieber. We were working on different music videos, doing some modeling shoots and doing different films.
commercials. We met the Bryan brothers who played tennis with each other.
So we were really excited, and we're like, wow, like we're living our dream. We're like pursuing our career. And then all of a sudden, when the acne hit, it was like we felt like we couldn't no longer pursue a career in the entertainment business because we were so just self-conscious of our acne. And I remember when we went to American Idol, we got to meet the judges of American Idol, which is Harry Connick Jr.,
Jennifer Lopez, Keith Urban,
Ryan Seacrest.
Right, Ryan Seacrest.
And I remember like standing in there, Ryan Seacrest is interviewing us saying like, oh, are you guys so excited to go in there and meet the judges? And I'm just like, as he's like looking at us, I'm literally just thinking, he just must think we're such a joke.
Because we had acne like all over our face, couldn't cover it up. And
Can you show us a picture, Gustavo? I mean, now is a good time to see what they're talking about.
I mean, it was absolutely devastating.
So this is a picture of me, Nina, and this is actually, I took this photo because I changed to the low-fat style of eating and took this photo because I was like, wow, it's so much better.
This is her skin.
This is getting better. It was actually worse than this. And so just, when we were on American Idol, we just couldn't even think about how
to perform,
to sing. We just were thinking about, oh my God, everyone's going to see us on TV with this embarrassing acne.
And I think one of the things about acne is I don't think people who don't have acne don't realize how much it affects your personality or how much it affects your self-esteem. And a lot of people just kind of rub it off, like brush it off, like, oh, don't worry, you'll outgrow it. But it's like, no,
they treat it like it's normal, and it's not normal.
And it's just like, no one has to have acne covering their face and be depressed about it. But yeah, I remember on the plane ride home, we were just like, we just felt like failures. We're like, I don't feel like
do it anymore.
We can't do this anymore. I don't want to sing. I don't want to go out on auditions. I remember like also when my acne was at its worst, I went into a casting office and the casting director just kind of looked at me. Normally I have like a conversation and I'm super upbeat and I feel good to book the job. But the casting director kind of just looked at me and just like, all right, that's enough. Like, and I really didn't even get to like do it multiple times. And I just like remember walking out of the casting, just like looking at my feet, just like, man, I don't want to do this anymore. Like this is just shattering.
Because you look at TV, you look at commercials, you look at television, movies. I mean, you don't see people with face full of acne like that. You just don't.
And I remember like back when we were doing a lot of commercials, we would be on antibiotics, and then when our skin was clear, we'd book a commercial. We'd be like, yay, like we booked a commercial. But then the acne would come back. It's like, wow, we can't work anymore, you know?
Because eventually the antibiotics stopped working.
And our agency, when my acne was at its worst, I actually had a meeting to meet my agent and pick different headshots. And he saw, you can't cover up skin. No amount of makeup is going to cover up acne like that. And he was just like, he tried to be nice about it. He's like, okay, well, let me know when your skin clears up, because he doesn't want to send us out when we have acne because it makes us look unprofessional. It makes them look unprofessional. So we couldn't work.
And on top of that, because we were so embarrassed by this acne, we isolated ourselves even more because we didn't want our friends to see. We didn't want boys to see. It was just so embarrassing.
It's literally every aspect of our life that gives you happiness was shut down. We didn't want to date, which is like very important in your 20s.
We didn't want to work.
We didn't want to go to the gym. We didn't want to hang out with our friends. We didn't want to work. We just had nothing. We were just like stuck in the house, just depressed. And the crazy thing is, it's just such a simple fix. You don't need this acne.
All right, so here you couldn't get a job. You had great opportunities with the American Idol and various other well-known celebrities, and here as models, actresses, you couldn't get any work.
Mm-hmm.
When did your revelation? When did your revelation come as to what you ought to do about this? I mean, you tried antibiotics. You were on antibiotics.
Mm-hmm.
Washed your face really good.
Mm-hmm.
You were vegan. You ate a vegan diet.
Yeah, we were like obsessive about this acne. We were like, we clean our pillowcases every day. We would,
go to the dermatologist,
go to different facials, have them like pick at our face to like try and squeeze out the acne, or maybe we weren't being hyper hygienic enough.
One lady even told us, oh, like your brother had acne, you caught it from him.
Yeah, like as if it was like
we
lied on a pillow and like somehow caught this acne. So we had so many different theories that we were dealing with. And I remember we were on our way up to...
But before we tried this, we actually tried to do low carb. We read something online and we're like, okay, well, food does play a role in health. So let's try doing low carb.
A lot of the information online is
awful.
like low carb, and like doing that as a vegan or doing that as any human being is just like just rough. And it didn't work.
We lasted like 8 days, and I just remember like bawling my eyes out. I was so hungry.
It was horrible. So we were driving up to San Francisco, and we were talking about our acne. That's literally all we could talk about. And I remember my dad was like, well, why don't you see if Dr. John McDougall has anything about acne on his website? Because, diet is related to diseases, and acne is inflammation. So I was like, okay, like I'll look on his website. And I was like, oh, he does have something on acne. It says there are cultures in the world that don't get acne, and by eliminating even higher plant fat foods, that get rid of the oil and the avocado nuts and soy that you could get rid of acne. And we were like, that's it? Like that seems it felt like a eureka moment. Like I remember the moment so well, just being like, okay, like I'm gonna do this.
We remembered and thought back that when our parents went out of town to Hawaii, we got really, really sick.
Mm-hmm.
And all we were eating was peanut butter toast because our brother was making food for us.
Mm-hmm.
And our acne was just getting worse and worse. And we just thought, oh, it's because we're sick. And we went to the doctor to try to get
infections,
antibiotics to get better. And they were more concerned with our face than like our respiratory infections. And that's when it hit us like, oh my gosh, I think this is
a problem.
This is really bad.
Yeah.
And so, then we saw this article.
And so I was like, potatoes, like rice, beans, like that's online. It's like says to avoid all those foods if you have acne. And I was like, great, I can eat these foods. Like I know exactly what to do. And it just right then and there, like within a few days, I was like, wow, it's for once in my life, it's not getting worse. So I was like, okay, I think it's working. And I remember within a month, the acne was significantly better. And I remember I kept thinking, oh no, like when's it going to stop working? Because that's what it always was with the antibiotics.
It gets better and then it comes back.
It gets better and now it comes back worse. And I was just like, wow, like, but it's continuing to get better. And it was really as simple as that.
And then even a year later, actually, when we traveled to Europe, we switched face washes because we didn't have the right one. And Randa started getting acne again.
Yeah, and I was like, what's going on?
And she's like, I gotta check out.
I'm eating perfectly. I don't know what is making me break out.
So we went back to the article.
I was like, okay, I'm gonna go back to McDougall's website. And I was like, you said avoid oil in your skincare products. And I was like, it was another eureka moment of, oh my God, the information was right here. And then I cut the oil from my skincare and I cleared up again.
Well, that's I think while I'm doing this next bit of discussion, to show another before and after picture would be worthwhile at Gestapo if you could. I want you folks to see this article that I wrote in November of 2003. Let's see, 2003. This is, let's see, you're 20 years old. You were 4 years old then.
We're 25 years old. So.
Oh, you were 25. I thought you were 20. Okay, so you were 9 years old when I wrote this article.
Yeah.
Okay. It's called Acne Has Nothing to Do with Diet. Wrong. You can get it on my website. It's free. It's free on the website.
That's the article we read. Yeah.
That's the article. That is the article that started it all for Randa.
Implications of dairy products. This was March 2011 about the implications of dairy. And those are both on my website. Oh, there you go. How dairy in itself changes the hormones in the body and promotes the acne development. But it's the oil that you have to.
Totally.
Anyway, let me get back to the point I wanted to make before we go on with Rena. Oh, good. Mary's getting it now, so we know everything's running well. Before we get back to Nina and Randa, I'd like to tell you what their therapy and all the therapies that people are getting, men and women, boys and girls, are getting for acne all over the world are based on one flawed study. One flawed study. It was published in JAMA in 1969. 1969. Here it is right here, folks. You can look it up. Okay, one study. Will you go to the dermatologist tomorrow and ask the dermatologist about the study that causes them to tell every patient diet has nothing to do with acne? You ask them for the research. They will come up with one paper. This was by a guy named Fulton. He took 30 adolescents, and this study published by the Chocolate Manufacturers Association of America. They sponsored the study of 30 adolescents. That's it. What they did, is they fed them 2 different diets. So it was a controlled study. You know, they had a control diet and they had an intervention diet. The control and intervention diet contained the same amount of fat. Well, I list the amount of fat. Same amount of calories, 557 versus 592. And the subjects, anyways, it was the same amount of fat in the 2 diets. The only thing that changed is they added chocolate to one of the diets. That was the only variable. And they counted the pimples, and they found that those who, there was no difference whether you added the chocolate in the intervention group or you left the chocolate out in the control group. There was no difference. But they were the same high-fat diets, the exact same diets. And then there are multiple studies talking about populations. In fact, you brought those out very nicely in your YouTube video, Nina and Randa, about various populations around the world. I cite some out of Africa. You cited other populations, the Okinawans, many populations around the world that still eat the McDougall diet, the starch-based diet, very low in fat, very low in animal products, which the whole population is acne-free. I mean, think about it. The fat you eat is the fat you wear. You wear it under your skin and you get obese. You wear it on your skin where the bacteria eat the fat, clog the pores, give you sores, give you blackheads, give you whiteheads, give you enlarged pores. You look at people's skin, okay? And you'll find that some people have these great big huge pores in their skin. Well, that's because of the high-fat diet, trying to get the fat out of the system. Yeah, and then, of course, you have the infection from the bacteria, which gives you the pustules, which is the acne that you saw so well on Nina and Randa's face. You know, it's so stupid simple. The fat you eat's the fat you wear. I mean, good grief, folks. Where do you think that fat goes? And I had my hairdresser. In fact, I've recently had to change hairdressers. Both of them have noticed that people have different greasinesses of their hair, and they think it's genetic. And I said, no, it's what they eat. You know, your clients that you do the hair do's on, who eat high-fat diets, have greasy hair. What do you expect? Anyway, I just want to put it in perspective that all the doctors that treated Randa and Nina and all the other acne patients worldwide are doing it based on a study where they fed 2 high-fat diets to 2 groups of people sponsored by the chocolate industry, chocolate candy industry. 1 study, that's it, on 30 people. And the only variable was the amount of chocolate, not the amount of fat. And they counted the pimples and they were the same. Therefore, diet has nothing to do with acne. Excuse me, back to some sane people. Let's talk to Rena.
That's when you said genetic loads the gun and diet pulls the trigger.
You think of all the suffering that's gone on. And acne is, you know, like I say, it's to some people, like, you know, at times when you got really down, and some of the people you've talked to have gotten really down, when you think about suicide, that's, you know, individual destruction. But we're facing planetary destruction, folks. Mm-hmm. Go ahead.
I was just going to say that Nina and Randa ended up telling their story when they got this transformation, and really just a couple of months. Mm-hmm. They went on their YouTube channel and made a video about their experience, which attracted a lot of interest because there's a lot of people, you know, dealing with the same problem. And they began getting, you know, people asking, tell us about the diet. And it was basically the McDougall diet with no overt fats. And kind of they customized it for their generation.
It's like maximum weight loss version,
right?
With fruit more, except I know in maximum weight loss you can only have like 2 pieces of fruit, but it's basically the same.
Right. Yeah. So I mean, they didn't want to lose weight, so they took measures to stop losing weight while doing the program. I did the program with them, and I lost almost 30 pounds. I mean, I decided to do it for support, and I'm really happy that I did. That was some years ago, but so. You know, they started sharing this information with videos and pretty soon getting feedback from people that, oh my goodness, sending their own before and after pictures, you know, it's working for me too. So that was a signal that this wasn't just a fluke, you know, that that the Okinawans and these different cultures are acne free, eating a starch-based very low fat diet, or primarily plant-based. And so they had sort of like a study group in terms of all these people. And then they decided to do a real study, right? To see kind of have it medically supervised.
We got Dr. Steve Lewenda from Kaiser to run a study and, teach all the health advice, why it works and how to do it right and how to lose weight if you want to or maintain your weight. He explained everything in in-depth detail. And we would meet every week, and it kind of became like this acne support group, almost like a group where we could say how we were feeling, like, oh yeah, like I totally understand how you're feeling, and like check in and like make sure they're doing it properly
as well.
And we would just, it was really fun because we became friends with a lot of these
people lost weight. How much weight did the whole group lose? Do you remember that?
I forget, but
30 pounds.
Steve tracked all of that. Steve Lewenda. Do you know Steve Lewenda?
No, I don't.
He's at Kaiser. He's a physician down here in Kaiser, and he runs a program called Life 180, which is sort of, a McDougall program in Kaiser that's just increasing in popularity. But he kind of tracked everybody, and we had Chef AJ was involved, and we had Darshana, from Forks Over Knives. We had some great people who came in and, helped give instruction and inspirational talks. And like they said, it was sort of like a support group where at the end, every Tuesday night, we met in a room over at a church nearby, and people would, wouldn't
Stay
leave.
Really
they'd sit together,
like, guys, we
talking
can't
about
be here
acne
anymore. We gotta leave.
Yeah, we're out of this room at 9:00, guys. We gotta go.
Yeah.
So they moved to the parking lot. So there was it was like the first acne support group maybe out there, which is another interesting feature.
And what was cool is we had a Facebook group later, and these same people that also cured their acne, we opened it. We had people submit to be in this Facebook group, and then it
people
became
from all over the world, like Brazil.
Yeah, it became,
South
and then we
America.
would do online webinars.
Which you took part in, John.
Yeah.
And a lot of people.
Online, so it reached even more people. And what was really cool is seeing the people from the first acne intervention group
help the new people.
They were sort of coaching, and plus, and through this, people were submitting their before and after shots, and Dr. Lewenda was documenting mainly on photographs based on the internet.
And it's really cool. Oh, sorry.
Yeah, the improvement that many people were having, some very quickly, some taking more time.
Yeah.
Gustavo had some of those pictures, but I don't know. Go ahead.
And what's also really cool is when new people join who are just starting the diet, like, oh, I'm concerned, like this isn't going to work for me, or I'm just really scared to try this. They're like,
but then other people give them.
But then other people are like, oh, just keep at it, like,
So this is Ashley.
See other people's pictures.
This is Ashley, who actually wrote to you, John, and sent you these pictures and copied Nina and Randa at the time. And she had dropped out of college because her acne, was so bumming her out.
This picture doesn't do it justice.
Yeah, it's a little pixelated, but basically, within a month or so, she had dramatically. It lessened her acne.
Well, and it's crazy because some people might be like, "Oh, that's so dramatic. You dropped out of college." I see that, and I'm like, I get it. Like, it's not just psychologically painful; it's actually physically painful too. Yeah. You can feel it 24/7. Oh, it's not a big deal. It's like, yes, it is. It hurts. It hurts my soul, and it literally hurts. So
yeah.
Well, you've had a chance to deal with dozens, if not hundreds, of people. How often do you find the dietary approach, when people do it, fails?
On the acne, it doesn't work. I think
the thing is, if someone writes
here's what I would say, John. You were asking for Elle, and I don't know if Gustavo can bring up the photograph of Elle.
It took her
someone who was very severe acne. You'll see on the before, and then it resolved. And Elle was somebody who had very severe acne and didn't have much progress probably for 4 months.
6 months or something.
And she then started tweaking, and we have like an elimination diet for really stubborn cases. Mm-hmm. So it seems like the success rate is there for people who put in the time and work through it. And Elle is a great example because it took her 6 months, but she stuck with it. She stayed with it, and she sort of just had a faith that, hey, I've got really bad acne, so it's going to take more time.
Yeah.
What's the drug that
Accutane? That's what I was going to say.
Accutane takes 4 months for many people before it actually begins to affect and bring down the inflammation. So
when we started clearing our skin, we would still get occasional zits. It was just smaller and smaller and smaller.
It was like a bit of a process.
It wasn't like an overnight thing. So if it doesn't clear up for someone, in 4 weeks I'm still getting some zits. It's like, as long as it's less, just like you said, Accutane takes like 4 to 6 months to start seeing results. So just stick with it.
I think a lot of people are kind of focused on, oh, I want the quick fix. If it's not working by tomorrow, it's not working.
White cream.
But when you think about it, when you go to the gym, when you're working out, when you're training for a marathon, you don't just go to the gym for like a week or one time and expect to be in perfect shape. No, like things take time, and that's what we tell our people. Like, okay, just like chill. It's gonna work. Just give it time. And a lot of people who do write, oh, it's been like 4 weeks and I still have some acne. We're like, okay, well, we always ask them like, what's your skincare? Like, what is everything you eat in a day? And then we can like find what they're doing wrong, or just say, give it time. And then like there was someone who like was constantly writing to me every week, like, it's, my skin is still breaking out. And then it's like, well, I was like, just keep doing it, keep at it. And then 6 months, it's clear. It's like some people just need to have faith and give it time.
One of the problems, I think, is that there are people who get cleared very fast. There's some people who with dramatically, like Nina and Randa, they didn't have acne for very long. Only for like 7 or 8 months did they have really bad acne before they discovered this information. So they didn't have a lot of scarring. They didn't have a lot, but other people maybe for years have been suffering pretty severe acne. And so it's not going to, it's like turning around a big ship or something. It's a slow process. But as I say, there's some people who come in and look, in 3 weeks, I'm all clear. I can't believe it. And that actually kind of depresses some other people that are taking longer. It's like, wow, look at her. She's done in 3 weeks. But stay the course is kind of the message, because that's like that picture of Elle you will see. She's somebody who could have bailed after 3 or 4 months and say, hey, this just isn't working. But she was convinced and determined to really give it a shot. And she got amazing results.
And what is cool is because now that the group, our Facebook acne intervention group, is pretty big now, that there have been people who've cleared their acne that are still in the group, and other people will come in, oh, it's only been a few weeks, it's not working. And then other people come in and say, don't worry, just give it time. And
right. And even people who are in the book, some of them are in the group whose pictures are in the book, and they'll come in and say, hey, that's me on page, 236, and let me tell you, it took me 3.5 months to get there, so stick with it. So there's a lot of support and inspiration going on inside the Facebook group for the Clear Skin Diet.
Well, mentioning the book, which has become a national bestseller, and Gustavo will put up an image of your new book. I had the privilege to write the foreword to this book, and I want to thank you very much. I would like to more directly answer the question that I asked you, and that is, how often does it fail? And the answer, never. It never fails. You just have to get low enough in fat. If people will, go on a very basic diet, say Mary's Mini diet or the Kempner diet, or, take our diet seriously, we recommend to get nuts, seeds, and avocados, except as delicacies, then it's 100%. We run 10-day programs, 10-day living programs. In fact, we start one tomorrow. January 26th, I believe, 25th, 26th. Anyway, 2019. We start one tomorrow with almost 60 people in it. And I will tell you, I will be there, by the way. Mary and I will be at the program. When I see patients, I find that without exception, within 4 days, the oiliness on their skin has started to clear up.
Yep, it's that quick.
Right away. And you see it, unless they're cheating. And one of the things you didn't mention, Nina and Randa, because you're nice and you're not young and you're naive. But Walter Kempner said it well. He said all dieters are liars.
Yeah, I was gonna say that actually. Not in those words, but
a lot of the failures are misunderstandings on people's parts.
Yes.
Either they didn't hear it right from you, or they themselves are not interpreting. Because we like to hear good news about our bad habits, and it's hard to change. So don't feel like it didn't work this time. They just didn't do it or understand it, because it works 100% of the time.
Yeah. Actually, we had someone who, when we were, trying to get people enrolled in our first group, someone was like, "Oh, I've tried that diet," and I was like, and she had really severe acne. I was like, I don't believe that. And then, we get to know her, and it's like, she's like, I have veggie grill. I have like, stuff like fries with oil. I'm like, you're not doing the diet at all. Like, so I found that to be true, that when people comment like, it's not working, I'm like, okay, well,
let's find out what you're eating.
What are you eating? What's your skincare? What are you doing? And then lo and behold, there's like an error, and it's like, well, now you're in the clear, and it'll work.
It is so basic. The fat you eat, the fat you wear, and the fat you put in your mouth has to go someplace. And when you stop eating the oils and fats, and this means nuts and seeds and avocados and olive oil, good fats, bad fats, miracle coconut oil, whatever, bacteria love to eat it, and it ends up on your skin. And when you stop eating the oils, your skin dries out, your acne clears up, but it takes some time. In about 4 days, the oil is gone from the skin. It may take a month or sometimes 4 or 6 months. And, then again, there are a lot of people who are providing some extra fat from their cosmetics, as you mentioned, oils on their skin. And there may be a problem with people losing weight and that providing extra fat that goes on the skin. So that may be one of the reasons that there's a delay, say, of 4 to 6 months before complete clearing occurs, because at the same time, they're producing body fat from the fat that they've been eating for the last 30 years. From their own body fat. So I find that in about a month, most people are thoroughly convinced that their acne is under control.
Yeah.
And it may take 4 or 6 months to clear up the scars and the redness
Yes.
but it happens very fast, and it's 100%, and it's based on more than one study published by Fulton in 1969 in the Journal of the American Medical Association, where the only variable was having chocolate. It was still the same high-fat diet. You ought to go to your doctor with this study, your dermatologist, throw it on his or her desk and say, you owe me $10,000 for the summer. This is absolute ridiculous that you as a doctor know nothing about diet disease.
Yeah, I remember we went in so often because of our acne, and then one time we went back in for, I don't know, maybe we wanted a moisturizer or just something simple, and they were like, whoa, like, how did you clear up your skin? And we're like, oh, it was the diet. They were like, oh, interesting. Like, they had no idea.
They hadn't seen it before.
It was like your mom, 30 years ago when we first started working together with her relapsing polychondritis. She went back to the doctor, and the doctors didn't really believe her, as I remember. And he said, but whatever you're doing, keep doing it. And she has for 30 years, and no more. I mean, this is a disease that kills, much less takes your nose away, your ears away, and your cartilage, all of your body away.
The scary thing about acne is that, I was going to say the scary thing about people who get acne is they're much at a higher risk of getting cancer later in life. So it's like this acne was a big blessing of like, hey, something's wrong. Your body's signaling you need to make a change.
You know what's funny too is I feel like all the time, like older women will come up to me and say, you're not going to look like that forever. Like I don't know why, but like 40, 50-year-old women always feel the need every week to tell me, you're not going to look like that forever. And in my head, I'm like, you're wrong. You're absolutely wrong.
Let me show you a 73-year-old woman who looks like that forever. I can get her to come in the room. What do you think, Mary? Let me see it. So look at that. 73 years old. And I'm sorry, folks, but she's gorgeous.
Aww.
No large pores, no pimples, really very few wrinkles. 73 years old, and has been through a tough year just like I have the past year.
Oh, glad to see you guys doing so much better now.
Yeah, we're doing really well. And I'm still just as in love as I was 46 years ago.
Aww, goals.
Cool. Anyway, thank you, beautiful girl.
Oh, you're welcome, honey.
It'd be like Al Gore and his kiss that lost the election. Get out of here. Oh, shoot. Anyway, okay. So you have this Facebook group that people can join. Yes?
Oh, yes,
we do.
Clear Skin Diet.
Clear Skin Diet. And we showed the book, the Clear Skin Diet book, which you can get on Amazon or any bookstore can order it for you. Yep. And it's a good read, great read, and it will help you a lot. Are you back to work? Anybody hiring you?
We did a music video, I think, for a few weeks ago. Another girl on American Idol. We played one girl. Yeah, we played the same girl. It was like kind of like a special effects thing. Yeah, so yeah, we're still auditioning, still getting out there,
still making videos,
still doing everything.
Good.
Dating, that's important too.
Well, she just had a breakup a month ago.
Yeah, that's okay. That's not because of her acne.
Well, 25 years old seems awful young to me now, but that's about the age when Mary and I met.
Yeah.
Because all I can tell you is it goes fast.
Yeah.
Well, talking about dating, how about a question for you, girls? Someone here wrote a question that says, "How do you go out to eat and stay on diet while dating?"
Okay,
That's a good one. Do you want me to answer? Can I answer?
I'll go first.
Okay,
Okay.
you.
For me, when I just meet someone, I'll be like, I don't just come out and say like, hey, like I'm vegan, like try to be kind of like in someone's face because that's not my style. But I do say like, yeah, I used to have really bad acne. Here's a photo. So I eat this like specific diet, and they're like, wow, like.
You can't tell at all.
You can't tell at all. You have amazing skin. That makes total sense. They totally respect it. Or, oh yeah, I had acne in high school and I took Accutane. That's amazing that you figured out a way through diet. So then they have some automatic respect. And then, if
they don't, then bye.
if they don't see it. But the guys generally like, okay, like let's go to does this restaurant work for you? And then there's always something you can order, like a potato or rice or beans. And if a guy gives you a hard time about it, next.
But also, what we like to do is if we know that there's maybe not going to be like a lot of options for us, we'll like eat a snack before, eat a little bit before, and then order something small like a salad or steamed rice or steamed vegetables. Like there's always something, really.
Yeah, honestly, LA dating though, most people aren't trying to like take you out to a meal just because people just aren't trying to put in that kind of effort. But honestly, the guys that do, if they like me enough, they don't care. Like, wow, well, this girl looks beautiful. I can't really criticize her diet.
Yeah, but what do you order when you go out?
Yeah, just like rice, beans. There's always some sort of steamed options.
Yeah.
Something simple.
Steamed vegetables.
And how about you, Nina? Do you have any particular problems with dating?
Not because of my food. It's my personality, I guess. No, I'm kidding.
Their maturity.
I can tell you just a little on the shallow side.
I'm on the shallow side?
No, shy side.
Shy.
Oh, on the shy side?
not
No,
shy.
I'm not shy at all.
I'm shy.
Randa's just doing a lot of the talking.
Well, that sure didn't come across.
Yeah, no, she's actually, people think she's the shyer one.
I'm like more shy when it comes to like guys or like maybe people my age, but Nina's not that way. But maybe
okay.
I don't know.
I feel like the guys that I gravitate towards as well, I like guys that care about the environment and like sustainability. So when they hear that I eat a certain way, it's like
that makes sense.
That makes sense. I'm into that too, and I don't know, they just like it. So that's the kind of guy I like. So I don't have a problem.
I don't want to get too personal, but have you ever told any of the guys that they stink?
Okay.
They smell like meat and dairy.
That's funny.
Actually, like some of the guys, actually, I haven't dated that many guys, but like a friend who's a guy, I have been like, you need a shower. Like, and I could tell like it was from the meat. And when he did cut back on the meat and dairy, he did smell a lot less.
Actually, yeah, one guy that I dated, he was doing like keto, like hard, like meat, no sugar, this and that. And I was hanging out with him, and we had a friend, and she brought up like, but what about like the smell you get like when you eat keto? And you could tell he was like really insecure because that's one of his things. Like he does have a smell problem.
Yeah.
I never pointed it out to him.
I pointed it out to Nina. I was like,
She
this
pointed
guy
out to me.
smells.
I didn't care because I loved him, but it's fine.
The keto diet is the extreme, but the average American stinks.
Yeah.
They just don't realize it because everybody around them stinks the same way. And that's the truth. I mean, it's just foul.
I always get told that I smell really good.
Yeah.
So.
People tell me that I smell really good.
And actually, someone I have dated, I'd be like, oh, like your hair smells like fast food.
Wait, I want to know who that is.
It would gross me out.
Who is that?
Yeah.
I'm not going to say here.
Well, I'll let you in on a little secret, even though you're only 25, is that through your olfactory lobes, by smell is how you fall in love. And how you're sexually motivated. It's odor, not sight. So it's really important that you smell good. And when you're eating animal foods and dairy, you stink. You smell like what you eat. There's another attractiveness issue. But the acne, of course, they can see a mile away.
Yeah.
Other questions you might have for our esteemed guests. Stop.
I know somebody. I thought it was funny. Someone said, "Does all this talk bother Dad about dating?"
I was thinking that too. But they're 25 years old, Jeff.
Yeah.
No, I don't think it bothers.
It doesn't. It bothers
I'm
our
okay.
brother.
Yeah.
Our brother is like, we can't say anything about dating to him because he will just be very angry.
No. We've got some. They brought some great guys around who I like by and large. Yeah.
Well, that's good. That's
This question, Dr. McDougall, might be for you. I mean, or the girls, I don't know, but someone says, should I eat nuts even though they have they're high in fat to get my period?
No.
Okay.
Oh,
Get your
you
period.
don't need nuts to get your period.
We'll let John answer.
are you still getting your periods?
Yeah.
Oh yeah.
Regular on the dot.
No, if you are severely restricted in calories, in other words, you're
Yeah.
starving, then your periods will stop. It's just a natural selection type thing. If there's not enough food, then the body will not reproduce. It's just a survival mechanism. It happened during World War II in the prisoner of war camps in Germany. The women didn't menstruate because they were starving. So that's the only reason that you have any interference with menstruation. But I do want to focus on that nut thing because that's where Randa and Nina got into trouble. They were vegans, strict vegans, and the same thing with Jeff Nelson. He was a strict vegan, but he told you he lost 30 pounds. The problem with being a vegan is that it's real easy to be a sick vegan, a fat vegan. A vegan that lives on nuts, seeds, avocados, olives, olive oil, corn oil, fish oil, well, not fish oil, but
Mock meat.
flaxseed oil and so on. And these oils are poisonous in the form of nuts and seeds and avocados. They're not unhealthy, but they're still 90% fat. And that fat, the fat that you eat is the fat you wear. And so, that's why the vegan gets into trouble of being overweight, which at least half of them are, and suffering from acne problems like Nina and Randa had.
Mm-hmm.
And Jeff, who's a marvelously handsome father, he looks tremendously younger and healthier and stronger now, 30 pounds later. So would you comment on what I just said about nuts and seeds and vegan cream pie?
I think a lot of people think you need nuts and seeds, especially to grow your hair long.
And we're like,
which is not
guys,
true.
that's not a problem for us. We have very long hair.
When people say, oh, like, what about your periods, this and that, we just say, oh, if you're eating enough, you won't have a problem.
Yeah.
Can you put
when we
Nina
speak-
and Randa's before and after pictures up again for us, Gustavo? You've made a lot of friends along the way.
Yeah.
Have you had any backlash from the medical profession or anybody? I mean, after all, you've written a book that contradicts virtually 100% of dermatologists. 100% of those SOBs, and whatever that stands for, male or female, 100% of dermatologists are giving misinformation. Oh,
Yes.
maybe it's 0.0001% I'm wrong about. Are giving misinformation based upon one study published in 1969 that changed the amount of chocolate, not fat, in the diet. These men and women ought to go to jail.
Mhm.
Did I say that? I mean, people who steal your money and hurt you ought to go to jail, don't you think?
Yeah.
Don't let me be in general.
What do you think? Do you have
I don't think
dermatologists?
I don't think we've had any backlash. I think we've had more of like people interested in, I think people are more open at this point, right?
Yeah, I mean, they've had dermatologists who have come up to them after a talk that they've given,
Yeah.
who've said, I want to carry your book. I want to advise this to my patients. And so they're people, they're just, the reason they don't promote it is because they don't know about it.
Yeah,
no one
they're not
explained
aware.
it to them. No one ever showed them pictures. No one ever, they weren't aware that somebody tracked 127 people with acne, and look what happened to the vast majority
But
of
if
them.
everyone cured their acne, they'd run out of business. So maybe
Yeah,
that's
'cause I'm
not.
sure
Maybe that's why they're not taught it.
That's like
I'm
the
just saying,
main
you
thing.
have met dermatologists who are advising theirs and who are, suggesting it for patients, and because they found out about it. You know what I mean? And it's funny. I was at it.
Jeff, I want to point out ignorance is not an excuse. I mean, if you get in a drunk driving accident and you say you didn't know alcohol would make you drunk and get in an accident, that doesn't hold up in court.
True,
These
true.
men and women spent these men and women spent 8 years learning about the human body, and they learned nothing about diet.
Yeah, it's crazy.
Nothing.
Yeah, it is pretty crazy. Yeah, they all
let me introduce one question for you, Nina and Randa. And with this, Dr. McDougall, I think we will need to be closing pretty soon. But
I think our guests are here to go see King Tut.
yeah,
We're going to go off after a McDougall lunch, low fat, no acne producing lunch.
exactly. So someone is writing here in the chat that they have been doing this, form of eating for 4 months and got improvements with acne, but then hit a wall. Is there anything else I can try?
Okay. Well, I would ask them, does their shampoo and conditioner have oils? Does their skincare, does their makeup, does their face wipes, all that has to be oil-free.
Anything you put on your face. I would also ask them, I'd be curious as to what they were eating. In a day, there are some people who, if they have severe enough acne, by eliminating even oats, because that is a higher fat food, that could put them over the edge of clearing up their skin. And then once it's all the way clear, they can reintroduce back oats.
Or even like you could do they eat gluten? Not that because gluten can be a cause for some people, and for a lot of people that's fine. But do they eat gluten? I would ask them exactly what they're eating.
Yeah.
Well, and I would suggest they go to your website where there's the link to the Facebook group.
Yeah.
Go to clearskindiet.com and then go in and enter the Facebook group and ask that question, because people do from time to time. And there's a number of different strategies that they can try, like you're saying they can tighten up their diet.
Yeah.
What is it? Somebody got rid of chickpeas and oatmeal.
Yeah, which I'm fine with.
They lowered their fat intake from, let's say,
Even
I don't know,
lower.
10% down to Okinawan level, 7% or something. And that did the trick. They suddenly started clearing. So, we've got the elimination diet. There's all kinds of strategies and people talking about things that they did to get results. So probably that would be my number one recommendation, is go into the group and talk about what's happening to you, and you'll get 40 comments from people giving you suggestions.
And we want to know exactly what you're eating in a day, because that could then help us, direct
sometimes
you.
Sometimes there's a misunderstanding.
That's so true. You have to know, even if they have a crumb of something, you have to know exactly what they're eating.
Because even some people having a teaspoon of chia seeds or whatever a day, that's enough to, one, make someone overweight who has a problem, and two, to give acne. So even a little bit of an amount really makes a difference.
The other thing I want to point out is that some of the people that you're dealing with are preparing foods for their family members, and so in the process of getting the pork chops out, they get grease on their hand. Some work as auto mechanics, and they work in greasy environments. You can get oil in all kinds of places that will cause acne. But the main source, of course, is 3, 4, 5 meals a day that people eat.
Totally.
Yeah.
Well, let me remind you about the book. Can we put up the picture again for the book, Pablo? You want to get this. This is a worthwhile read, to say the least. You got it right there. And also, how do we get the Facebook connection?
How do we connect them, Dad?
Probably the easiest way is to go to the website Clear Skin Diet, and right on the top it says Facebook group. So you just click, and that will take you right into there, and you just apply, and you get accepted within 15 minutes or something like that, and then you're inside the group. Post your questions, and talk to other people who are doing the program.
Okay. And you can always go to my website at drmcdougall.com and read an article I wrote when Nina and Randa were 9 years old.
What got all this started?
Basically everything they have in their book. That's the foundation of what they have in their book.
Yep.
It's been around forever. Well, folks, I want to thank you very much. Were there any other things you wanted to add for people to know so they could get some extra help?
I think the takeaway is to just give it time and stick with it.
And do it 100%. Do it 100%.
Yeah. And there are people who do it 100% and they clear, and then they play with it, and they go back and they tell us, their inflammation went down, their skin cleared, they decided to
Have some avocado.
and they didn't break out. Someone else, they have some avocado. It's all back. But everybody's a little different. And somehow when people get their inflammation down significantly, suddenly their body maybe some people can tolerate these foods again. And so it's an individual thing. People do sometimes decide to reintroduce.
I don't miss the fat.
Nina and Randa, no, they're just like, they don't want to chance it at all.
All right, well, one of the things you have noticed during this conversation is that these folks are not out to sell you anything. Not any supplements, not even a book. You can go to their website and get up to the information. It's the same thing with Dr. McDougall at drmcdougall.com. Well, that's my email address. At our website, drmcdougall.com, everything's free. The articles I told you about that I wrote many years ago, 1969. Well, that was a study, 1969. And the diet, everything is free on the website. Or, if you'd like a little extra help, well, we run 10-day programs. We start one tomorrow, which is the 26th, I believe, of January, 2019. We run several programs every year, like 6 or 8. And we run weekends. We have a weekend coming up in March, 3-day weekend, the most inexpensive, cost-effective thing that you can do. And you'll find those all at drmcdougall.com. So if you would like a little extra help, it's all there with Nina and Randa's book and Facebook and website and on my website. It's all there for free. But sometimes it's easier to learn. Always it's easier to learn if you've got leaders, mentors, speakers, examples of the food which we feed you during the weekends and the 10-day programs. That makes the change a lot easier. So thank you, folks, very much.
Thank you for having us.
And you say hi to Willie. That's their brother. And it was interesting. Willie came to one of our programs to help Jeff film it. And he came with some acne, and it was mentioned there. And guess what happened to Willie's skin?
In 10 days, his acne cleared up. By the end of staying with Dr. McDougall's event, documenting it, filming it, and eating the food, he didn't have to do anything. He loved the food. His acne went away.
Oh, the food's amazing.
That proved it up for Willie.
That proved it for Willie. It always works, folks. I mean, the diet is so fundamental. It's as fundamental as a smoker who quits smoking, stops coughing, a drunk who stops drinking, stops falling down. It's the same thing with the food. You stop eating the food, you'll stop being sick. The rich American diet. And so says the Lancet Eat Commission. And so says the Canadian Dietetic Association. I'm no longer ahead of my time. I'm getting old, Jeff.
We knew it would happen. We knew the world would catch up one day.
Yeah, well, it's good for me to see, and I really mean that. You've known me for 30 years, and you know that I've been a bit discouraged. Finally, the world is in agreement. There's no
hashtag winning, John. Good job, you're winning.
Gustavo Tolosa, my good friend, I want to thank you for making this webinar possible. And I want to thank the Nelsons for not only their experience, not only their time with us today, but their effort to help people worldwide out of the goodness of their heart. They're not selling anything. They just want to help. Thank you very much. It's Dr. John McDougall. We'll be back with you in 2 weeks with another amazing guest.
Yes, we will.
Thanks, John. Thanks, Gustavo.
Thank you.
Thank you, everyone. Thank you so much. Goodbye.
Bye.
Bye-bye.